Epilepsy. People living with this nerve disorder have seizures that can affect their mental and physical functioning. 2.2 million Americans and 50 million people worldwide have epilepsy. Although there are medicines to treat epileptic seizures, nearly 1 in 3 patients has severe side effects from their medicines. These side effects can be reduced by adjusting drug dosage and timing and using lab tests. However, these tests can be inconvenient and costly. Dr. Utkan Demirci is developing a portable device to measure anti-seizure drugs in the blood. His device will allow patients and their caregivers to manage their treatment anywhere.
Imagine there is a seizure, there is an emergency. How do you treat them next? Do you give them drugs, or have they taken already their drugs? Are they overdose or they are under dosage? The only way to know that today is to be able to do a lab test in a hospital setting. What we are trying to bring is these tests to the side of the patient under an emergency, so that with a finger prick of blood, primary responders would be able to know what to do, especially in prolonged seizures. You need results now. Results that come in a few hours would not really allow us to know accurately what happened to the patient. The technology is unique. It's almost like a technology coming out of Star Trek movies, where you can scan someone and know about their medical condition right away, right there, when you need that information. It is a simple device made out of paper. It can be burned, it can be disposed, it's flexible. It doesn't cost anything more than probably a few pennies. Blood just fills the channels, and during that process we are able to simply detect by using either a cell phone or a simple reader, like one would use in a glucose reader, the drug levels in patient's circulation. And this allows us to be able to get that valuable information rapidly to the first responders and at the clinic, or to a parent who would like to know in the morning if their kid is going to have a seizure. Glucose tests have changed how we look at diabetes and how we approach it. This test will have a significant impact on the life of epilepsy patients. Winning this prize will allow us actually to take this technology to a level where we can test it with patient samples and sharpen it to a level that it can be available commercially. Today we have technology in our fingertips. We have everything that comes to us. Why not bring healthcare also to the fingertips of the patients?